So some places consider it up to 24 as the numbers Emilia just showed, but others establish 30 years old or 35 years old as the cut. So it depends on the context and in the country. So it also makes it a bit harder to come with statistics. But even so, we can assure that there's a great part of the world's population that is part of the youth and part of the global south countries. So the first reason we decided to focus on that is a matter of quantity. Our world today has the larger generation of youth than ever before. Half of the global population is now under the age of 30, and the global south is home of almost 80% of the world population, or with an even younger population. So the current median age for these countries is of almost 25, and for other countries against the global average of almost 40. So we can see that a lot of the population is of under 30 years old. According to data from the UN, as of 2019, 90% of the world's adolescents lived in low and middle income countries. And so promoting youth health and well-being is therefore a global health priority. When young people are healthy, engaged, and educated, that is an investment for society for many years to come, whereas the opposite might lead to alarming trends of a growing number of young people who are unemployed or undereducated or with lifelong mental and physical health issues. So that makes it quite relevant for us to discuss this theme, increase our repertoire of interventions that target that. And that's why we have two amazing speakers to share their work and experience in this domain. So first, let me introduce Professor Daniel Oviedo, an associate professor in urban transport and development planning at University College London. He's a civil engineer with a master's in transport planning from Universidad de los Andes and a PhD in development planning from UCL. Daniel research will show how encouraging children to walk to school boosts physical health, mental well-being, and community cohesion in projects in Colombia and Mozambique. Then we have Aya Haidar from Nudge Lebanon. Aya is the Vice President and Executive Director at Nudge Lebanon. She holds a degree from the American University of Beirut and has experience in behavioral insights and policymaking. Aya presents findings from Lebanon on building household resilience during economic crisis through behavioral interventions. Her behavioral map study with Nudge Lebanon and Save the Children identified psychological barriers limiting vocational training success. By implementing target behavioral nudges and mindset interventions, including social influencers, the program improved training completion rates and income generation while creating cascading well-being benefits across families and communities. We're really happy to have you both here. And just some housekeeping rules. We'll have Daniel's presentation for around 15 minutes, then followed by some questions. Then we have Aya's presentation, followed by individual questions as well, and then a general Q&A. So please feel free to post your questions on chat, interact, comments, and we'll do our best to make sure that they're all answered. So with that, I pass the word to you, Daniel. Thank you so much for being here.
Thank you for
It's great.
Yeah, we can see it.
Maybe it's me. Yeah, I can see it now. Great. Well, thank you for and I'll try to be as quick as possible, partly because many tunnels are ahead. First thing, well, my name is Daniel, as I was on the way to school. Interventions in the context of Colombia have for children's well-being by taking them actively to school, meaning walking and cycling. And then our own research is trying to build on those lessons to implement a pilot in the context of Mozambique. So we're speaking about children who are as young as 4 and usually as old 16, 17, who are walking and cycling routinely to school. And when we think about taking children to school actively, there are quite a few challenges, such as how do we encourage or maintain a healthy level of physical activity? How do we ensure their safety and security, not only from the risks of the road, but also the exposure to pollution, to crime, to violence, and other types of challenges. as well as sustainable travel. Move to the next one, please. And connected to those challenges around active travel, we have identified that non-communicable diseases are one of the biggest challenges that our youth is facing at the moment. And as I was saying in the introduction, adolescence is a critical time to change habits and to try to address the factors that can create risks of suffering from diseases, cardiovascular diseases in the future. And what has happened in many places and now is becoming a sustainable trend in the global south, as I'm going to explain from the case of Colombia, is that active mobility to and from school interventions have become a more regular instrument from the public sector to try to reduce these challenges and to contribute to higher levels of physical activity. And in particular, they're seen as a way of improving the life of children, but we don't have the evidence to actually support that aside from sort of the more anecdotal kind of analysis, particularly because when these type of interventions are implemented, as I will show in a second from the specific case of Colombia, it doesn't necessarily have the, the baseline data to then compare the impacts. So if we move to the next one, please. And the data is clear. Actually, data from UNICEF, from more recently than the one that I have at the moment on the screen, says that a young person under 24 dies every 30 minutes in Latin America and the Caribbean. And then we can see what happens in many of the cities, the largest cities in Latin America.
I guess
Sorry, yeah.
So
yeah, I'm hearing some noise, but probably not more than the one that I have. So what you see is that cities like Bogota are actually leading the statistics in the number of cyclists and pedestrians who are dying, and that's interesting because it's actually one of the cities where most people walk and cycle routinely. And when we see this by different age cohorts, the truth is that the number of fatalities connected to children who were traveling on their own or accompanied walking or cycling is quite staggering, which is what initially motivated the interventions that we are researching. We move to the next one, please. So what we're doing is looking at these interventions and what are the effects on physical activity and well-being. It's a 3-year project, as I mentioned at the beginning, that focuses on 2 global south contexts, Bogota in Colombia and Maputo and Maracay in Mozambique. The interventions take children walking and cycling to school, and we're funded by the Global Alliance for Chronic Diseases and the Medical Research Council in the UK. And it's a quite multidisciplinary team that is led from the development planning unit in UCL, but that involves professionals from all different disciplines, particularly from medicine. If we move to the next one, please. So we have 3 main objectives. We want to understand how these interventions are planned, developed, and evaluated from a perspective of implementation research. And our target population is 2 to 16. And what we want to assess is not only the current effects, the observable effects, but also the potential for the prevention or the reduction of risk associated with chronic diseases. That our innovations lie in the fact that we are using evidence to fund the potential of these AMDS as an additional argument for the public sector to be able to invest further in this type of intervention in the perspective of children and adolescents who are using the interventions or who are interested in taking part or at least walking or cycling to school, as well as putting dialogue implementations, something that comes mostly from the medical sciences and the social sciences to strengthen. Sorry, I'm sure the delay with the slides is probably on my end. So what we're trying to do, I haven't seen the slide change though, but what we're trying to do is to understand the history and the acceptability of these interventions in the context of Colombia. So our number one, to prevent these non-communicable diseases through physical activity and well-being, as well as to evaluate, number two, the effect of those programs in those two specific outcomes. What we want to do with that learning is to adapt and pilot two similar interventions, one walking and one cycling in the context of urban and rural Mozambique, and to understand how these programs can be adaptable and change to different contexts in order to prevent this type of risk for non-communicable diseases. The core of the project is the use of equitable collaboration to foster learning process around research, around policy and advocacy, around implementation of this specific intervention. So because this is something that is introduced quite early in the life of the children and adolescents that are taking part on the interventions, we have a whole set of different methods that we have been using to understand what are the responses, the emotional responses, the stress responses, the biological responses, as well as what are the changes in behavior from the children and adolescents, as well as understand what are the effects of the built environment, using citizen science and giving literally voice to the children, which is something connected with the specific routes that they're taking and the types of environments that they're exposed to. So we are recording everything using GPS and have a whole set of other quantitative and qualitative elements, being effects, and to understand what decision makers were thinking and are thinking at different moments of the history.
Daniel, I believe you muted yourself.
Or maybe we have lost him.
There.
Sorry, Daniel, we lost you for a couple of seconds. Should we, and we lost him completely. Should we then maybe stop for now and maybe wait for later if he can reconnect, and maybe we can start with Aya? Would that work? And maybe keep the questions to ask him later, because also I'm conscious of the time. We have 5 more minutes, but maybe give him some, maybe he's going to go through a bad connection area. I'll stop sharing my screen now. Aya, you are there. Good.
Yes, I'm available. So I can go ahead and share my screen. And then we can jump back to Daniel if hopefully he manages to.
Sorry, yeah, this.
Don't worry, Daniel. He's probably not going to listen. I'll send him a message and carry on. But that was actually up to there. That was very interesting. I don't know what everyone thinks, and we don't forget that we're going to share the slides, obviously, with your permission, Daniel and Aya. So we can always share the complete deck so that you can look at it as well. That's the whole point, that we share the knowledge between academics and practitioners. So Aya, to you.
Great. Thank you so much. I am sharing my screen now. I think it should be visible. So first, I'd like to thank you not only for hosting us today, but also for organizing this platform for practitioners who are applying these projects in the Global South. It's particularly interesting to me to listen to others and to learn from lessons learned that not only link to the impact evaluation, but the process itself. So designing and implementing interventions in these contexts always comes with so many challenges. So looking forward to our discussions, and hopefully we'll get the chance to ask Daniel some questions as well, because we do have some projects that are being implemented at the moment in Mozambique. So I'm going to get started and present to you our work, which we have implemented back in 2022 in collaboration with Save the Children and different implementing partners in Lebanon. So I'm going to give you a brief overview of the context in question for those who are not familiar with the situation, which unfortunately at the moment has become worse. But back then, we were dealing with the collapse of the banking sector, repercussions of the COVID-19 pandemic, increases in unemployment rate, the Beirut blast in 2020, and ongoing security and political challenges. And this has naturally affected the youth, particularly in Lebanon, where we have more than a fourth of the population being refugees, and host communities as well who are severely affected by this situation. And against this background, Save the Children was working on implementing a large-scale project to support the economic development and social stability in Lebanon as part of a program funded by the EU to assist severely vulnerable households to become more self-reliant. And we had 4 main outcomes, with outcome number 2 being the focus of today. So we back then collaborated with the different partners to implement SBC interventions across all 4, I think all three outcomes, because the 4th one was kind of cross-cutting component. But we're focusing today on outcome 2, which links to the livelihood pathways and essentially vocational and entrepreneurship trainings to households which were identified as the most severely vulnerable households in specific locations in the country. So the youth, in this case, who were part of this program, they participated in either vocational or entrepreneurship training. And we, as part of the project, we started with a diagnostic phase where we implemented a behavioral mapping research. We conducted review of existing data, literature, reports, interviews with key stakeholders, and we mapped out the process map or the journey map of the key stakeholders, in this case, the youth who are participating in these programs. And we have identified a long list of challenges stemming from both behavior and structural roots, which uptake of these programs by participants. What I'm sharing here is a non-exhaustive list. This is just for illustrative purposes, just to show you how we looked at the process. We identified the challenges, and we then, with the partners, this was very collaborative. So we identified the priority challenges that we wanted to focus on, and we worked on a series of benchmarking activities to identify what could be possible behaviorally informed solutions to help us address particularly the behavioral challenges that we have identified here. Because yes, we have, let's say, audited the structural challenges, but that went into the recommendation. So it was very difficult to at this stage to create changes in the way the program was delivered or these types of challenges. So we decided to focus on what would be accessible and feasible to implement within the restrictions and the duration of the project that we had. So against this is where we worked on ideation sessions with the different stakeholders, and we worked on what we call a think group session. So we brainstormed the different ideas, and we had many votes for the growth mindset intervention. So that was the most popular one, and we decided to proceed with this work. And back then, we also reached out to Amara, which did an amazing job with guiding us and with providing us her experience based on the interventions that she has led in the past. So what we did in terms of the design is that we designed 2 interventions, and the first one consisted of adapting the growth mindset videos to the local context, and to basically deliver different videos to the participants in the vocational and entrepreneurship training, focusing on key principles from growth mindset. And their understanding was kind of, or the scores of growth mindset were tested pre and post intervention, in addition to different sessions consisting of retrieval practices in between each video. And we also had a control group, which was not subject to any of these interventions, but where we have a baseline. So we have the survey that was administered for the control group. On the other hand, we had a different intervention group, which consisted of the growth mindset videos and a live event, which was delivered by a very famous YouTuber in the Arab-speaking countries. He's Egyptian, but he's known for creating entertaining and educational videos that simplify complex topics in science and history. And he's very witty and funny, and we reached out to him back then, and he was kind enough to volunteer and to deliver this session in Lebanon. So we discussed with him, we presented him with the growth mindset theory, and we shared with him the books and the relevant literature, and we agreed with him on like a high-level script. And he delivered a live session in one of the locations of the intervention, which was preceded by a pre-survey and followed by a post-survey to again assess the immediate impact of the intervention on the growth mindset indicators. So moving on to the results. What I'm showing here on the slide is the results of the fixed mindset index. So essentially, as part of the survey, we had a series of questions, and some of them corresponded to a growth mindset index, whereas other questions corresponded to fixed mindset index. And what we're showing here is the results for the fixed mindset index, where we see overall, if we're looking at the total sample, we see a statistically significant improvement of over 12% with the videos moving towards the growth mindset index. If we look at Akkad, which is the location where we implemented the videos only. So we had some logistical restrictions back then. We were not able to deliver the event in both provinces, both governorates. So what we did is that we decided to deliver the session, the live session in Baalbek, and then in Akkad we only had the videos that were displayed and delivered to the participants. So what we see overall is better improvements with the combined interventions, especially in Baalbek, considering the moving away from the fixed mindset. Similar trends here. when we're looking at the shift towards growth mindset of the growth mindset index. And this was consistent across beneficiaries, but again, more pronounced in the governorate of Baalbek. And we saw better improvements with the combined intervention. So these were the results that this was the analysis that we worked on back then. And this is in terms of the key takeaways, or I thought of what would be the best way to present the key takeaways or the recommendations. And going back again, this was implemented in 2022. I felt like it might be nice to share some of the strengths and the limitations of this work, and to open the space for questions. So in terms of the strengths, the demonstrated shifts in participant scores towards a growth mindset are particularly significant given the challenges that were faced in this context. So this indicates that the intervention is relevant and has great potential for scale up, especially considering the cost and the ease of embedding this kind of these types of activities in existing programs. Second, the effective coordination among consortium partners who were trained on SBC principles enabled streamlining stakeholder engagement across intervention delivery and allowed monitoring and evaluation processes. So I think one of the key wins, and what the client was very happy with, again, towards the end of the project, was also this soft capacity building that was integrated within the delivery of the set of these different interventions that we had, because we designed the interventions, we trained the local partners to deliver them, and we had to embed these soft skills and the skills of, let's say, the M&E skills and behavioral science skills for implementing partners who are doing this day-to-day work and who are always in the field. So this really was something sustainable, and this was something. This was one of the key wins from this project. We also got very positive feedback from the partners who acted as agents of change within their communities, and particularly for the growth mindset intervention, they also felt like it was something important for them, and for them to learn about these principles and these theories on a personal and for their day-to-day work. Now, when it comes to the limitations, as part of the work that we did, this was restricted within the timeline and the resources that we had. So we tried to design and implement something that could be assessed and evaluated within a very short time frame. So the study in this case was unable to assess the intervention's impact on secondary outcomes, such as some KPIs that were part of the overarching Save the Children program, which is the livelihood capacity assessment scores, or program completion, or attendance and retention rates, because some of the programs were lasted beyond, I think, 2 years. So we were not able to look at this data and look at the longer term impact. Moreover, the limited time and resources prevented the collection of in-depth qualitative feedback, which would have been valuable for adapting the content, particularly for the videos, and to improve the usability and potential scale-up. And we were again unable to assess the medium and longer term impact of the interventions or potential spillover effects within the broader learning environment. So this is kind of in a nutshell what we worked on. And I'm going to stop here, and over to you, Amelia, to see if we have any questions or if you want to go back to Daniel. Thank you so much.
I think we could start with questions with you, Daniel. I think he's still on, but maybe because you did your presentation, we can ask you some questions to you. Would you mind talking a little bit more about those negative or spillover effects that you were talking? Can you develop a little bit more on that?
Yeah, absolutely. So, in terms of the, let's say, the negative feedback or the areas for development, I think because we did not have a lot of time to adapt the content, so we did for the videos, we did pilot them. We initially adapted them to Arabic, to the official standard Arabic, but then once we went to the field and we tested them out, we got the feedback that no, we want this not in the Lebanese dialect, but in the Syrian dialect. So because the majority of the participants were Syrian, so then we went back, we changed the content and the delivery, and we adapted it to the Syrian dialect. We also got some feedback that it would have been preferable if the characters weren't as childish as they currently were in the video. So we would have obviously needed much more time to generate videos and to work on the production. But this would be something in terms of like scale up recommendations would be to create characters that resonate more with the communities and with potentially the end users and the participants as part of these interventions. In terms of the live event, it was also a bit challenging to pilot. So we did agree with the content creators on the script. We tried to simplify as much as possible and to kind of agree on the points that also resonate with the content in the videos and in the other training sessions. But one of the like most, I think, the things that I remember is that we got feedback on the dialect of the delivery of the event, which was in Egyptian Arabic. And nowadays, in this context, maybe older generations are more familiar with Egyptian because they're more exposed to music and pop culture, but then with younger generation, not as much. So it was a bit challenging, especially for the younger participants to follow the content in some areas. But yeah, this is in terms of the content. These are some of the areas where we think we could have improved on back then.
It's interesting what you say about the videos, Aya, because I actually share with some of my friends that speak Spanish in Argentina, and they liked it, but maybe most of my friends have kids that are younger age. And like you said, it could, what works in a country cannot work. It's same in Latin America. You know, sometimes you get videos that are in neutral Spanish that might not work in different countries. There's nothing better than listening to someone that is talking your own language. It like really goes, or the images, like you said, to adapt it. And this was one question that we also had for Daniel. I don't know if Daniel, you're still there, to do with the context and how great, how different it was from Colombia and Mozambique, and the cultural, the context matters, and how to adapt that. If you can maybe talk about that, and scaling or yeah, testing in both countries, how different would it be or has been?
Sure, there are quite a few challenges around the context. The first thing is the institutional capacity. Whatever the government of Bogota was able to do is going to be very different to what the government of Mozambique might have in mind or have the capacity to deliver. So the first thing is that from an institutional perspective, there is already a track record of more than 20 years of Bogota working on walking and cycling infrastructure in general for the city, and then in creating a culture for people to find that as a feasible mode of transport, which in a way has also addressed a underlying cultural issue, which is for society, the car tends to be a symbol of wealth and power, and for walking, especially walking, but increasingly cycling was a symbol of poverty, right? So, and then there came a change in the civic culture and sort of the mindset around cycling, that it became something interesting for the middle class, and I think the city could leverage its institutional capacity to start building programs and infrastructure that supported that trend towards more cycling. In Mozambique, is the opposite. You have a large number of people who are depending exclusively on walking, with a huge association to poverty. And that, of course, makes it undesirable for people to walk. When speaking with adults, you could say that people who are studying or who are working professionally and have to walk for business purposes, or that arrive with their shoes dirty because they have been walking on the street, they are seen over the shoulders, or they are ignored, and it's something that is undesirable. So how can you ask in that context for them to actually take their children walking to school, for their classmates to make fun of them? And yet we see that in many of the schools, such as the ones that we're working in, 80% of the population is moving on foot. So, but there is not an idea of that this is something desirable, and that goes as high as the decisions that are made from the public sector. You know? So, the priority and the budgets go to whatever has to accommodate motorized infrastructure. It can be public transport, and fortunately, that's something that has become more and more relevant for the current agenda, but definitely not on the side of the attitude towards walking and cycling. So that has been sort of the first challenge, and then that scales down to the level of the community and to the acceptability of people, particularly the parents. On, I mean, their children are going walking because they have to, but then to put a spotlight on that walking as an intervention that is then supported, that has a whole set of additional activities, and to some extent noise, has become a matter for initial discussion, and then increasingly a dialogue that we have tried to leverage towards making the intervention something that makes more sense for the local context. The cycling is different. The cycling in most African cities where we have worked, there is not a culture of cycling. There is not, many people don't know how to ride a bike. So the intervention needs to start from 3 or 4 steps before than you do in Latin America, particularly in Bogota, in this case, where the children already had a culture from their homes, being that bicycle for those who couldn't get access to one. So that has
Amara, do you want to use the technical gap for
Yes.
your question?
Yeah, sure. Thank you. Thank you, Emilia. Oh.
Thank you, Daniel. We lost you for a second there, but Amara, I think, has a question.
Sure.
Thank you.
Thanks, Emilia. Just a question for you, Daniel, and I hope that you can hear. So you talked about sort of promoting walking in Mozambique. And also what I picked up from your presentation was that you were giving the kids activity wristbands. So I'm just wondering, in terms of the implementation challenges, you know, being from South Africa and from the continent, whether that was something that you needed to consider, you know, in terms of giving people wristbands. Did you get it back? Were there issues with that? Did they lose it? And then also the promotion of walking in Mozambique, was that a safe thing to actually do? So that is just a question for Daniel. And then I also have just a comment for Aya. So, of course, she mentioned that some of the, especially the videos, there were issues with regard to understanding or not really resonating with the participants. That was very similar to what we had in South Africa. So we used, and well, interestingly, the videos worked very well because it was with younger children, so in primary school and high school. But then the language was an issue because, of course, they didn't like the American accent. So what we then had to do for the scale up was actually change that to South African dialects and South African languages. So that seems to be a recurring theme, whether you are in South Africa or whether you are in Lebanon. It does seem that language and just local example seems to be really key in making an intervention work. So I think that is certainly something that I've picked up. Thanks, Emilia.
Perhaps I can go first because it seems like the connection is stable right now. So thanks for the question, Amara. I think there are two elements to that. One is the safety angle. I think the safety angle is as relevant in Colombia as it is in Mozambique, and actually one of the main reasons why the program started in the first place in the public sector was because of the high rates of accidents and fatalities. And what we have found is that in Mozambique, even if the project is thought from a perspective of physical activity and healthy habits and change of culture, the road safety aspect is the main concern for the public sector, and that has been our main point of entry for the intervention, and that has also been the main concern from the parents who have shared in what we've done. We haven't implemented the intervention yet. We are at the moment of design. So what we've done some consultations with parents and caregivers whose main concerns are around safety and security. So especially from a gender perspective, also what's happening with young girls who are walking on their own in the middle of the neighborhoods and in some cases across very stretched alleys, which can pose additional risks for their personal safety. So what we've done is sort of trying to identify those key points of entry and then to start conversations with the community about how to best implement it, and the incentives that they have for participating in the project is that we are essentially going to fund the whole intervention as well as we're covering some of the cost for their participation. But the idea is that this is something co-produced that then the community can take forward. So what we're trying to do is to work with the local leadership in Maputo for them to set up a committee that can then not only run and monitor the intervention, but actually advocate for it with the public sector so it can have sustained funding beyond the life cycle of the project. I hope you guys could hear.
No, all
Yes,
clear. Thank you.
Thank you. Ayaji, you want to? Do you want to answer Amara's question, or Amara, do you want to just leave it as a comment on the language and the barriers and how things need to be adapted to really have a success, or at least close to success intervention? Do you want to
No, I think
comment on it? Yeah, okay.
I think I'm covered. I think just to sort of share, and I know that Aya was sharing a little bit about scale up as well. I think what I did want to ask Aya was about the training that she conducted with the partners, and if that also came up as a feature for potential scale up, because I know that you mentioned that they really appreciated the fact that they were almost getting skills transferred from the Nudge Lebanon team to them. And so I was just wondering if that also factored into your potential scale up, if it were to ever scale up, if that's something that you would consider as sort of a must have.
Yeah, thank you so much for this question. I think this is very relevant. We were having these discussions as we were wrapping up the project because again we had three outcomes, so three series of interventions, and across the three interventions, capacity building was a key pillar, and this was something of high interest back then to save the children who were our client. But then we did discuss the potential for following up with different phases, but unfortunately that never happened. I think it was mainly due to funding issues and to challenges. But this was something that was definitely discussed back then. But for this project in particular, we did not have a follow-up phase. For other projects, we do notice this trend where we have an initial phase that focuses on the design and implementation of an intervention, and the kind of the capacity building component that is there, which triggers the appetite for phase 2 of a collaboration where we focus more on capacity building of stakeholders. But for this project in particular, unfortunately, that was not the case.
Thanks, Aya.
No, if Flora has her hand
I have a
raised.
question for both of you. So when it comes to well-being, we know that social connections, so having healthy relationships, are one of the key aspects of that. And I found it really interesting that you both use this component in a way. So in Aya's project, you had in one of the interventions, the delivery mode was through a person, right? So beyond only the content of in a video, you had someone who was delivering it in a more proximate way. So when it comes from a social influencer, you don't only have that he's more like didactic to explain, but also it comes in a place from identity or from relatedness and all of that. And then in Daniel's research, not only physical activity is a key component, a key mechanism towards well-being, but also doing it as a group. And I wonder if you could elaborate more on that, if you found that this specific component provided additional benefits, in your case, or Daniel, if from the implementation side, you found that the children and the adolescents found benefits from being connected and not only from the movement part, or how maybe that made it easier from them beyond seeing only from an individual perspective. And also, Aya, in your case, beyond only content delivery or the information provision, but rather this social learning in that sense.
Happy to go first. So thank you, Flora, for this question. This also reminds me of, because we were implementing in 2 governorates, and we did notice some differences across the various implementing partners, and this is very relevant because the more so whenever the implementing partners had members of the community who are taking part of this, and the closer the members of the communities were, so the more we had, let's say, Syrians who were part of the teams who were working during community engagement and mobilization, you could tell the difference, and you could tell how much more effective the message was when it came from people who were identified with by the communities. So definitely, I think this component was very important in this project, also relevant across multiple initiatives that we have worked on. So yeah.
Okay, I think we're coming to an end. Caroline.
Yes. Thank
Thank
you
you,
all
Aya.
for joining us today. A big thank to both of our speakers for the important contributions and for sharing such valuable perspectives on youth well-being and behavior science in Global South. We try to send you the Daniel's presentations and slides and insights so you don't miss any of his work. To get updates, please scan our QR code on the slide to join our WhatsApp group. We'll be back in September for the next Global South session. The date and topic will be confirmed soon, so stay tuned. And don't forget to follow our LinkedIn page for news, resources, and upcoming events. Thanks again, and see you next time.
Thank you.
Thank you so much. Bye-bye.
Thank you.
Thank you. Bye.
Bye.
Thank you. Bye bye.